Hi, this is Alfred Brock, and today we're going to be taking a look at methamphetamine. What is methamphetamine? The information I'm going to be reading to you is coming to us from the National Institute on Drug Abuse, advancing addiction science and helping people across the country and around the world. So you can get their information from drugabuse.gov, and you can look this up at what is methamphetamine. But not only that, there's going to be a link down in the bottom of this video so that you can go and click on that yourself and go right there if you want to. And share it with others. Feel free to share this video also. This information was revised to February 2017, and we start out with what is methamphetamine? Well, methamphetamine is a stimulant drug usually used as a white, bitter tasting powder or a pill. Crystal methamphetamine is a form of the drug that looks like glass fragments or shiny bluish white rocks. It is chemically similar to amphetamine, which is a drug used to treat attention deficit hyperactivity disorder, ADHD, and narcolepsy, a sleep disorder. Other common names for methamphetamine include chalk, crank, crystal, ice, meth, and speed. Now, how did people use methamphetamine? People can take a methamphetamine by inhaling it or smoking it, swallowing a pill, snorting it through the nose, injecting the powder that has been dissolved in a water or alcohol base. Because the quote high unquote from the drug both starts and fades quickly, people often take repeated doses in a binge and crash pattern. In some cases, people take methamphetamine in a form of binging known as a run, giving up food and sleep while continuing to take the drug every few hours for up to several days. Now, how does methamphetamine affect the brain? Methamphetamine increases the amount of the natural chemical dopamine in the brain. Dopamine is involved in body movement, motivation, pleasure, and reward. Pleasure from natural behaviors such as eating. The drug's ability to release high levels of dopamine rapidly in reward areas of the brain produces the quote rush unquote or euphoria or flash quote flash unquote that many people experience. The short-term effects of the drug, taking even small amounts of methamphetamine can result in many of the same health effects as those of other stimulants such as cocaine or amphetamines. These include increased wakefulness and physical activity, decreased appetite, faster breathing, rapid and or irregular heartbeat, increased blood pressure and body temperature. Now, how do manufacturers make methamphetamine? Manufacturers make most of the methamphetamine found in the United States in quote super labs unquote here or more often in Mexico. But some also make the drug in small secret labs with inexpensive over-the-counter ingredients such as pseudoephedrine, a common ingredient in cold medicines. To curb production, the law requires pharmacies and other retail stores to keep a purchase record of products containing pseudoephedrine. A person may only buy a limited amount of these products on a single day. Now, what are the other health effects of methamphetamines? Long-term effects. People who inject methamphetamine are at increased risk of contracting infectious diseases such as HIV and hepatitis B and C. These diseases are transmitted through contact with blood or other bodily fluids. Methamphetamine use can also alter judgment and decision-making, leading to risky behaviors such as unprotected sex, which also increases risk for infection. Methamphetamine use may worsen the progression of HIV/AIDS and its consequences. Studies indicate that HIV causes more injury to nerve cells and more cognitive problems in people who have HIV and use methamphetamine than it does in people who have HIV and don't use the drug. Cognitive problems are those involved with thinking, understanding, learning, and remembering. Long-term methamphetamine use has many other negative consequences, including extreme weight loss, severe dental problems, also known as, quote, meth mouth, unquote, intense itching, leading to skin sores from scratching, anxiety, confusion, sleeping problems, violent behavior, paranoia, which is an extreme and unreasonable distrust of others, hallucinations, sensations and images that seem real, but they're not. In addition, continued methamphetamine use causes changes in the brain's dopamine system that are associated with reduced coordination and impaired verbal learning. In studies of people who used methamphetamine over the long term, severe changes also affected areas of the brain involved with emotion and memory. This may explain many of the emotional and cognitive problems observed in those who use methamphetamine. Although some of these brain changes may reverse after being off the drug for a year or more, other changes may not recover even after a long period of abstinence. A recent study even suggests that people who used methamphetamine have an increased risk of developing Parkinson's disease, a disorder of the nerves that affects movement. Are there health effects from exposure to secondhand methamphetamine smoke? Well, researchers don't know yet whether people breathing in second methamphetamine smoke can get high or have other health effects. What they do know is that people can test positive for methamphetamine after exposure to secondhand smoke. More research is needed in that area. Can a person overdose on methamphetamine? Yes, a person can overdose on methamphetamine. An overdose occurs when the person uses too much of a drug and has a toxic reaction that results in serious, harmful symptoms or death. Methamphetamine overdose can lead to stroke, heart attack, or organ problems such as kidney failure caused by overheating. These conditions can result in death. How can a methamphetamine overdose be treated? Because methamphetamine overdose often leads to a stroke, heart attack, or organ problems, first responders and emergency room doctors try to treat the overdose by treating these conditions, with the intent of restoring blood flow to the affected part of the brain in the occasion of a stroke, or restoring blood flow to the heart in the occasion of a heart attack, or treating the individual organ problems that may occur. Is methamphetamine addictive? Yes, methamphetamine is highly addictive. When people stop taking it, withdrawal symptoms can include anxiety, fatigue, severe depression, psychosis, intense drug cravings. Now, how can people get treatment for methamphetamine addiction? The most effective treatments for methamphetamine addiction so far are behavioral therapies such as cognitive behavioral therapy, which helps patients recognize, avoid, and cope with the situations in which they are most likely to use drugs. Motivational incentives, which use vouchers or small cash rewards to encourage patients to remain drug-free. While research is underway, there are currently no government-approved medications to treat methamphetamine addiction. Now let's go over some points to remember and then we'll wrap this up. Points to remember include methamphetamine is usually a white, bitter-tasting powder or pill. Crystal methamphetamine looks like glass fragments or shiny blue-white rocks. Methamphetamine is a stimulant drug that is chemically similar to amphetamine, which is a drug used to treat ADHD and narcolepsy. People can take methamphetamine by inhaling it, smoking it, swallowing it, snorting it through the nose, or injecting the drug. Methamphetamine increases the amount of dopamine in the brain, which is involved in body movement, motivation, pleasure, and reward. Short-term health effects include decreased wakefulness and physical activity, decreased appetite, and increased blood pressure and body temperature. Long-term health effects include risk of contracting HIV and hepatitis, severe dental problems, quote, meth mouth, unquote, intense itching, leading to skin sores from scratching, violent behavior, and paranoia. Researchers don't know yet whether people breathing in second methamphetamine smoke can get high or have other health effects. A person can overdose on methamphetamine. Because methamphetamine overdose often leads to a stroke, heart attack, or organ problems, first responders and emergency room doctors try to treat the overdose by treating these conditions. Methamphetamine is highly addictive. When people stop taking it, withdrawal symptoms can include anxiety, fatigue, severe depression, psychosis, and intense drug cravings. Finally, the most effective treatments for methamphetamine addiction so far are behavioral therapies. There are currently no government-approved medications to treat methamphetamine addiction. Thank you for your attention today. There's a link down at the bottom if you want to go through this yourself, share it with others, share the video. Be happy, be healthy. Thanks for listening. Don't do drugs.